And now let's look at another portion of the Affordable Care Act, and these are the health care exchanges. And what these are meant to be are marketplaces where people can go and compare different insurance policies in a way that's easy to do. And so the way this was set up before is that you would have to go to a health insurer and ask them what they would cover, and it was usually pretty complicated, and it was difficult to compare one to the other because they would offer two completely different things, and so you're comparing apples to oranges. So the Affordable Care Act hopes to help with that. So you'll remember that we talked about in a previous video that the plans have to have essential health benefits. You can't have a bare bones policy, which was missing a lot of things. And so there are certain things that need to be included, and these are what are listed here. So ambulatory services means things like walk-in clinics and doctor's appointments. ER visits need to be covered. Hospitalizations or any inpatient stays, so that includes your surgeries or if you need to stay for any medical care. Mental health and substance abuse. This is big because they didn't used to, all plans didn't used to cover this before. Prescriptions, rehabilitation, so if you need to get some physical therapy after a hospitalization, then that should be covered. Laboratory work and x-rays, preventive medicine, again, another big thing because this can be cost saving. If we could spend money up front preventing diseases from getting complicated and expensive, then perhaps we could save some money. And care for pediatric patients, so that includes not only all their medical care, but they also specified their dental and their vision stuff should be covered. So all of these essential health benefits need to be covered. Now they can add things on top of this, but at the very least, it has to cover this. So the insurers then can offer, they are going to be offering 4 different tiers of health benefits, and these are called the medal plans because they are named like the Olympic medals. And that makes sense because people will know that platinum is better than gold, and gold is better than silver, and silver is better than bronze. So it makes it very intuitive which ones are better. And the bronze policy is going to cover up to 60% of costs, so you would be responsible for 40%. Where the platinum is going to cover 90%, so you would only be responsible for 10%. So obviously, the platinum is going to cost more than the bronze plan. So you can compare bronze plans from insurer A to bronze plans to insurer B to bronze plans of insurer C and see which one is cheaper, knowing that they're all going to include this. They're all going to include the essential health benefits, so it becomes so much easier to compare. You'll also remember from a previous video that there's only a few things which can set the cost of the plan. So in addition to whatever kind of metal it is, bronze, silver, gold, or platinum, you can, plans, premium prices can depend on the age of the person, remember, but only to a limit. You can charge at most 3 times as much for older people as you can younger people. Whether you smoke, where you live, your geographic area, and the number of family members that you're including on the plan. So these are the things that are going to determine the price. So the thought here is that as you go shopping on the exchange, you are going to be looking at things that are offering comparable things, and they're going to be insuring you to comparable levels, so now you can go based on price. And so the insurers are, this is going to cause competition, and the insurers are going to want you to buy it, so they're going to want to make their plans cheaper so that it's alluring to you, that you want to buy it. And the only way to make this cheaper is if it costs them less. So they're going to be putting pressure on the doctors and hospitals to be more cost effective. So the thought is that this competition of the healthcare exchanges is going to drive cost effectiveness using market forces. Now, some opponents of the Affordable Care Act, especially those on the left, say that there are no direct methods to control costs. We only have this indirect method here. They said that you are not dictating the prices that doctors can charge. And the opponents of them say, well, we're using market forces to do so. And so that's, again, another controversy that exists with this plan, with the Affordable Care Act, that is. So another method of controlling costs is something called the medical loss ratio. And what this is here you have your insurer, and here's all the money that he has collected in premiums over the year. Now, the Affordable Care Act says that 85% of this has to be spent on health care. And that leaves 15% that can be spent on administration as well as profit. So if the insurer should take in enough premiums, so much so that this amount grows, that they're getting more and more in profit and they're not spending 85% on health care, then what they need to do is refund the difference to their insured, and they got to lower the premiums next year. So this medical loss ratio is hopefully going to curb the growth rate of the cost, the premiums. And so this is a quick look at the healthcare exchanges and the way the insurance is going to be sold, the way that it's going to be, be sold to people who need to buy it in a fair marketplace where you can compare apples to apples, right? Because everything's going to contain this minimum amount of benefits, and prices are going to be determined based on what kind of plan you get, a bronze, silver, gold, or platinum, and some other factors like your age, whether you smoke, where you live, and how many people are in your family. And the thought is that you're going to be able to now compare one plan to another, and this is going to cause competition, which is going to drive down prices. We also talked about the medical loss ratio, which says that the insurer can only take about 15% in profits and administration, and the rest they got to return otherwise, and return to their insured, as well as decrease premiums the next year. So hopefully that will help curb some of the costs and some of the growth in healthcare spending. And that's not the only way. We'll talk about some more in future videos, but these are the healthcare exchanges. Now, if you're watching this in November 2013, we're off to a bumpy start. Healthcare.gov. I had some trouble this was the website that they were using, and I had some trouble setting that up. Each state is supposed to make their own healthcare exchange, but if they don't, then they can use the federal one. And the federal one was our healthcare.gov, and that one just wasn't working. So they're working on fixing that, and I assume this will be a small hiccup, but eventually, hopefully, will start working. Okay?